very good evening, everyone, and welcome to our session. I am Dr. Tarinee Puri on behalf of Voice of Healthcare, and I welcome you all to the first session of Blue Wave of Change Navigating Colorectal Cancer Awareness Together, supported by Dr. Reddy's Labs. Colorectal Cancer Awareness Month is observed in March to highlight the importance of screening for colorectal cancer, as well as to promote healthy lifestyle habits that can decrease a person's risk of developing cancer of the colon, rectum, or anus, the three distinct cancer types referred to as collectively colorectal cancer. This series aims to raise awareness and provide comprehensive insights into various facets of colorectal cancer. Through a series of engaging panel discussions, we aim to address critical aspects such as early detection and screening strategies, highlighting the importance of timely identification and also discuss common misconceptions and barriers. And now, I'd like to welcome our esteemed speakers for the day, Dr. Vaibhav Srivastava, Chairperson, Cancer Institute, Lucknow. Good evening.
Good evening.
Dr. Suhail Qureshi, Senior Consultant, Oncology, Fortis, Shalimar, Bagh. Good evening and welcome
Good
to our
evening.
session.
Good evening. Thank you, and hello to all my co-participants on the panel.
Dr. Tanmoy Mandal, Consultant, Oncology, AMRI Hospital, Dhakuria. Good evening and welcome to our session.
Good evening to all.
Dr. Abhishek Anand, Senior Consultant and HOD, Paras HMRI, Director, Narayana Cancer Center, Patna. Good evening and welcome to our session.
Good evening, Dr. Tarinee, and good evening to all my fellow colleagues. Thank you.
Mr. Indrajit Sarkar, Commercial Head, Oncology, Dr. Reddy's Labs. Good evening and welcome to our session.
Good evening, Dr. Tarinee, and good evening to all the esteemed doctors in the panel.
It's an honor to have you all. So now, in this session, we will be focusing on early screening and diagnosis of colorectal cancer. And to begin our session, now I'd like to start the discussion. My first question will be to Dr. Srivastava.
Yeah.
So, doctor, could you please explain what colorectal cancer is, what its prevalence is, its incidence in India, and so on?
Yes. The colorectal cancer is abnormal growth of the colonic mucosa, resulting in mass formation or ulcer formation in any part of the colon, like cecum, ascending colon, transverse colon, descending colon, or rectum. These are called the colonic cancer. The incidence varies among the different group because of various genetic factors, but average approximately 30 to 40 patient per lakh of the population is can be the incidence. It There's more the because of the familial risk in some families, the incidence in such families are higher.
All right.
Also, yeah.
Yes.
Also, these are as because of the modernization of the our lifestyle and various other risk factor which we will discuss later on. The incidence and prevalence and even mortality of the colorectal cancer are increasing, and now more and more younger population are also affected by the colorectal cancer, which was previously not seen, because previously it was a disease of the elderly population, because there's a sharp rise of the curve of incidence with age, but nowadays we are seeing more and more younger patient with colorectal cancers. Thank you.
Thank you, Dr. Srivastava. So now, moving on to our next question, I would like to address it to Dr. Qureshi. What are some of the risk factors, and in which age group or in which sex or gender is it more common?
So, colon cancer has traditionally been classified and the risk factors have traditionally been classified into those which are genetically linked as well as those which are environmental risk factors. Now, environmentally, uh, classically, colon cancer has been associated with obesity, lifestyle, like a sedentary lifestyle, increase in weight, less fiber in the diet, increased consumption of red meat specifically. There have been certain studies which have also shown that certain diets are protective for the causation of colon cancer, such as a diet which is rich in fiber, rich in vegetables and fruits, as well as a modest exercise, which induces at least 5 to 10% of weight loss, is also known to lower your risk of developing colon cancer. Other than that, excessive consumption of alcohol is another one of those environmental risk factors that increases the likelihood of colon cancer. Speaking of genetic factors, now this is something that is really coming up in a big way of late. Many of the uh, familial adenomatous polyposis syndromes, meaning thereby colonic polyps, which are generally inherited, and these polyps eventually go on to transform themselves into cancerous polyposis syndromes, is one of the very important genetic or inherited risk factors for colon cancer. However, the risk is of FAP, which is familial adenomatous polyposis, is around 1 to 2% of the entire number of cases. Other than that, hereditary non-polyposis colon cancer, also known as Lynch syndrome, is a very important genetic cause for development of colon cancer, in which it is associated with not only the cancer of the colon, but also cancer of the endometrium in females, and also cancer of other organs of the gut and various other organs, including even for that matter, cancer of the gallbladder as well as certain brain tumors in Lynch syndrome is very well known. So these are some of the important genetic as well as environmental risk factors of colon cancer. Speaking of gender predisposition, it is more common in the male sex as compared to the females, and the age disposition is now becoming more towards the younger age group. If you were taught initially that it is a disease of the elderly, but now more and more younger age group patients are being seen in the OPD with colon cancer, and this is something which we are seeing very often in our OPDs these days, that we see colon cancer in people as young as 30 to 35 years of age.
Thanks, Dr. Qureshi. That was a very comprehensive answer. So now, building upon this, I'd like to address my next question to Dr. Mandal. What are the specific early signs and symptoms of colorectal cancer that individuals in the Indian population should be aware of? And how do these differ from general symptoms seen in other populations?
So see what the general symptoms and signs of colorectal cancer is mostly the bleeding upper rectum. That's the most important sign and symptom of any colorectal malignancy is. So what it happens is that most of the times we ignore one episode of a bleeding upper rectum during the passage of stool. In many situations, what happens is that we don't even understand that whether blood is flowing or not, because it might get mixed also. So this is what the most common symptom is. And the another symptom is that unexplained anemia. So any patient who is being evaluated for anemia needs a colonoscopy and an endoscopy to be done at for ruling out any unknown or any invisible colonic malignancy. That's one thing. So what happens is that if any patient presents with an advanced form of disease, colorectal carcinoma, suppose a patient has alternating constipation and diarrhea for a long duration and whatever, and suppose after a long duration of time, he sees that the patient presents to us with obstructive features like an obstruction of this large gut presenting with severe pain, abdomen, non-passage of stool, along with vomiting. So these are the symptoms when the patient might present. It's an emergency presentation, and the patient might be worked up and needs to undergo an exploratory laparotomy urgently. Yes, when the patient presents in an advanced stage, it might happen that the patient disease has spread to the other organs, like mostly it might present with liver metastasis, means spread to the liver in the form of a jaundice. It might spread to the abdominal wall in the form of abdomen in the form of ascites, where the patient presents with a huge abdominal distension or fluid in the abdomen. These are the other presentations in which colonic malignancy and rectal malignancy might present. So this is in short regarding the presentations and the symptoms and signs of colorectal malignancy.
Um, Thanks, Dr. Mandal. I believe there's some connection issue as well. So now moving on, as Dr. Mandal already mentioned about certain symptoms such as constipation, bleeding, etc. So now my next question is to Dr. Anand. So considering the diversity in dietary habits across various regions in India, how might regional dietary patterns influence the risk factors and early onset of colorectal cancer? And what role can early screening play in addressing these variations?
So as we all know that India is a very diverse country, and dietary habit is also very diverse. If we talk go from north to south and east to west region of the country, and there are many states where the habit of eating red meat is much more, and having the dietary habit of less fiber intake is very prevalent. So India, as per we talk, then the fiber which we take in our routine dietary pattern is very less as compared to the other countries, and therefore these are the risk factors also for increase in the incidence of colorectal cancers. So it is very important to go for early screening in India. And if you see the US Preventive Task Force screening recommendation, they say that it should be started from the 50 years of age till 80 years of age. And in Indian subcontinent, there are multiple trials and research that have suggested it can be started 5 to 10 years before the what the US or the Western countries start. So starting from 40 to 45 years of age for the screening is very important, and the important test which we go for the screening is the stool based test or the visual test. If we talk about the stool based test, we have got the stool blood or fecal occult blood examination, fecal IHC test, and then we have got a fecal DNA test. And these are the three important fecal based tests that screen for the colorectal cancer. And apart from that, if these comes as positive, the fecal test comes as positive, we should be going for the visual based test, and these are the colonoscopy, sigmoidoscopy, or we have got the virtual colonography as well. And these tests can be done to detect cancer at an early stage. That is very important, so that we can diagnose cancer at an early stage. And we all know that when we are diagnosing cancer at an early stage, most of the cancer can be completely cured. And as Dr. Qureshi was also telling that these days the incidence of colorectal cancer is increasing in younger population as well, because of many genetic condition, familial pattern, and other environmental factors, like bad dietary habits, like increase intake of alcohol, cigarette smoking, increase in the red meat consumption, processed meat, and processed food intake. So these are the dietary habits that are linked to the increased incidence of colorectal cancer in early stage as well. So it is very important that depending on the variety or diversity of the Indian subcontinent dietary habit, we should be applying these screening procedures early in the any population. That is very important.
Right. Thanks, Dr. Anand. So now we'll move on to Mr. Sarkar for our next question. So, what role does the Indian pharmaceutical industry play in ensuring that patients with colorectal cancer have access to high quality, affordable, and life saving treatments that are readily available to them?
Thanks, Dr. Tarinee, for that question. I will try to take a step back and answer your question. Your basic question is with respect to the role of pharma healthcare in providing high quality medications towards the treatment of cancer. But the other two parameters that we see has improved drastically over the years, especially in the last 2 decades, if I see, is in terms of the overall healthcare and the infrastructure. And the number of highly qualified DM and DMB doctors that we see passing out every year. Maybe a decade back, only around 100 odd highly qualified DM oncologists or DNB oncologists were coming out of academic institutes. But today, if our esteemed doctors in the panel can bet, I think nothing less than 250 to 300 qualified doctors every year we are getting. The quality of infrastructure has also improved. The government has also been spending a lot into various health initiatives. And then now add to it the role of pharmaceutical company with highly qualified doctors all across the country, spreading into the nook and corner of the country. The pharma industry's role has also been very deep rooted, and with increase in the infrastructure, the number of oncologists across the country, the pharma industry also has been able to play its role. Today, if I look and speak specifically about colorectal cancer, maybe some 15 years back or 20 years back, if I look back upon my experience as a sales and marketing guy, we used to talk a lot about the basics of colorectal cancer and oxaliplatin, or for that matter, 5-fluorouracil and irinotecan. Basically, Folfox and Folfiri kind of regimens used to be the landmark regimen, and that used to provide maybe a survival benefit of in and around 14 months to 16 months by and large. I am not going into the specific data, a broad figure. But with the advent of various pharmaceutical industry and the progression that the pharmaceutical industry has happened, how it has helped, coming to a specific question is, today we have a lot of biologicals, high quality biologicals, which are as good as the innovator company. And with more and more number of good quality pharmaceutical companies coming into the horizon, the cost of all such molecules has come down dramatically. What used to cost to a patient every 21 days, maybe more than a lakh rupees, today a patient is able to afford in the range of 10 to 15,000, which is very much within the available means for a majority large chunk of patients. Add to it the government benefits. So in terms of the healthcare reach and penetration and the role that pharmaceutical industry is providing, it is immense. What I said a short while ago, that in terms of benefit, previously a colorectal cancer patient used to get maybe a 14 or 16 months. Add to it the biologicals advantage. Now the survival advantage will be somewhere around 34 to 36 months if I speak of only a biological. Add to it the next generation of targeted therapy, the patient gets maybe another 5 or 6 months. So, and now all these treatments are within the reach of a good chunk of population. Also, the other point that we should also appreciate is, now there are a lot of companies, innovator companies also operating in India, but with the growth of the pharmaceutical industry, a lot of international companies who may not be having their footprints in the country currently are tying up with Indian companies. That also helps us in bringing those medicines which are not readily within our reach to market in India, and thereby offering the best quality medicines to all the patients available in the country, backed by our strong medical fraternity in terms of highly qualified and trained medical oncologists, radiation oncologists, surgical oncologists, and of course the facilities that are there and are increasing day by day. Yeah, Dr. Tarinee.
Thank you, Mr. Sarkar, for such a detailed answer. Actually, thank you so much. So now I'd like to ask my next question to Dr. Srivastava. So, as we have already discussed about early diagnosis and screening, could you help us understand how the early diagnosis, or by what percentage could it help in treating patients of colorectal cancer? How much of an effect does it have on treatment? And how does a late diagnosis or a delayed diagnosis, how much can it affect the life of a patient?
Yes, this is a very good question because it involves the fate of the patient. Also, the how good can manage in nowadays in present era, patient can be treated with such a drastic bad disease which mostly due to lifestyle related or genetic based related. So because of the screening, we have so many screening methods available, like as dr Abhishek already discussed, fecal blood, stool based test, and colonoscopy, ct, colonography, and video capsule endoscopy. So if we detect the disease in very early stage, okay, then we can either treat only locally, means we can only do the polyp. Most of cases, such cancer, colonic cancer, present as a polypoidal mass in the lumen of the colon, so which can be resected easily by the colonoscope only. So patient can have no further treatment will be required in the in situ disease or T1 disease. If patient also with colonoscopy, we can detect the multiple more than one lesion in the colon from cecum to rectum. So it's like some patient have genetic or familial basis, they have more number of polyps. So we can manage then on the local basis, and we can delay the progression of the cancer at very early stage. If patient presented as a locally advanced disease, means T2, T3 involvement or T4 involvement without metastasis disease, then patient may improve by the very small, because nowadays we have robotic surgeries available. We can small incision surgeries and robotic surgery. We can good surgeon, good surgical team can do uh, can treat the patient very early. And even if patient have no high risk factor, when diagnosed early, they can omit the any chemotherapy or radiotherapy, and can surgical treatment is enough for such patient. If patient presented like they have no screening, or patient have present de novo in the advanced or metastatic days, metastatic stage, then the patient life is very cumbersome, because he have to undergo multiple investigation like CT, PET CT, colonoscopy, biopsy, and various genetic studies in the biopsy sample like MSI, KRAS, BRAF, and RAF, which are costly tests. Also, patient will require multiple line of chemotherapy, and the intent of the treatment will not be curable, because when you give treatment, patient will respond to some few months to few years, then again metastatic cancers develop bypass to our chemotherapies or treatments, and they again recur. Then we have to again give different regimen or immunotherapy or targeted therapy to treat the cancer patient, which in, which worsens the quality of the life and also hamper them socially and economically.
Right. Thanks, Dr. Srivastava, for explaining the treatment modalities as well. So now, my next question is to Dr. Qureshi. So, as previously you mentioned genetic predisposition as a risk factor, right? So, so given the potential genetic predispositions within certain Indian communities, what advancements have been made in personalized screening approaches for colorectal cancer?
So, I think in India, the role of cancer registries becomes very important in this context. And although this is at a very nascent stage, I think we need to develop more robust strategies to identify those individuals or those communities in which there is a heightened risk for development of colon cancer. Now, as such, colon cancer is fairly common worldwide, but there is a significant geographical variation. And as Dr. Anand pointed out, there is a geographical variation in our country as well, pertaining to the lifestyle, pertaining to the uh, uh, consumption of red meat, and the consumption of alcohol and cigarette smoking patterns. Now, if even if the incidence of colon cancer in India is considered to be low as compared to the Western countries, the immense population that we actually have on our hands, even that minor percentage translates into a large number of patients. And that becomes a huge public health problem. And therefore, it is extremely important that we utilize our resources very well to identify those high risk groups, which may benefit not only from screening, but also from identifying the problem early so that we are able to utilize preventive steps for people who are at a heightened risk rather than only identifying them when the disease has already happened. So the role of cancer registries becomes important. We need to, because in India, many of these cancers go unnoticed and unregistered. So whatever we are actually seeing is actually the tip of the iceberg, and not everything is actually reported. So in terms of personalized screening approaches, you have now fairly freely available testing for microsatellite instability and for genetic predisposition syndromes, for genetic blood tests, which are able to identify those individuals who are at a higher risk for development of colon cancer. Genetic counseling is now fairly well entrenched, especially in tier one cities, and now percolating down to tier two cities as well, with the advent of more and more medical oncologists going to these places and more cancer centers coming up, and also better labs now which are available, which was not the case 10 years back when we used to send samples maybe abroad for genetic testing, and now we have these state of the art good labs available in India which are carrying out not only blood based testing but also NGS based testing on samples of the biopsy so as to determine what all targets can be identified for more personalized treatment of colon cancer once they have progressed on already the known lines of treatment. So I think these three or four important aspects need to be kept in mind before we, talk about this in a more comprehensive manner.
Right. Thanks, Dr. Qureshi. So now, moving on, my next question is to Dr. Mandal. So, in the context of limited healthcare resources in some parts of India, what strategies can be implemented to promote early screening and diagnosis of colorectal cancer? And how can these efforts be tailored to reach the underserved populations as well?
So see, we need the screening methodology in or screening program in India is still not in the center, is not still not within the premises of the government. We need, but as our country is not a very, it's a middle of order country. So what we need to do is we need to reach specific group of populations for the screening tests, and the screening tests which we might need to provide is should have a good cost benefit ratio so that it can be provided or it can be accessed by majority of the population. That is what is important. So what are the patient populations who are at higher risk, or whom do we need to put the tests on? That is those set of populations who have a higher risk of developing these, like the positive family history, or the patients who are having a history of malignancy, colorectal malignancy in the family, any adenomatous polyp. These are the high risk features which was earlier said. So these are the sets of population for which the screening should be more and more robust. So what are the methodology of screening which might be used? That is, one of them is a fecal occult blood test, because fecal DNA testing and fecal immunohistochemistry might be earlier on. So for a country like India, a fecal occult blood test is a much cheaper option and it's a achievable option. So that is one of the tests which we might do. And another is colonoscopy or a sigmoidoscopy, because nowadays with the advent with the improvements in the diagnostic facilities, we generally have a colonoscopy or a sigmoidoscopy in almost all the second tier and the third tier cities. So keeping all these this in mind, what I feel is that we need to reach the poor with these sort of tests, and it needs to be restructured in the high risk population more than the average risk population. So this is what should be the strategy be, and it's mostly the fecal occult blood test with a colonoscopy. The colonoscopy may be done for high risk population; it's in a different schedule. But for a average risk population, at least every 10 years after the age of 45, might be a good option to do for these subsets of people.
Right. Thanks, Dr. Mandal. Now, my next question is addressed to Dr. Anand. What role can emerging technologies such as artificial intelligence and telemedicine play in enhancing the efficiency and accessibility of colorectal cancer screening programs in India? Also, how could they help in general in diagnosis?
So, artificial intelligence and deep learning have emerged as revolutionary tool in the domain of cancer screening and risk assessment. And if you talk about the cancer screening program, especially for the breast cancer and cervical cancer, it has come a long way. And they are very important in the colon cancer screening as well, because many times these are stool-based tests and visual-based tests. These are the colonoscopy and sigmoidoscopy and virtual colonoscopy, that is the CT colonography. So, incorporating artificial intelligence and the telemedicine do improve in the awareness, and they also try to increase the number of population that can be screened for these tests for colon cancer, colorectal cancer. So these are come a long way in the screening program, and is being incorporated in the colorectal cancer screening as well. Although a standard protocol has still to be made, and I think in near future the time will come when artificial intelligence and telemedicine will be the important tools for screening of colorectal cancer as well. Especially if you talk about the telemedicine is very important, because many times we see that patients who are being made aware of cancer screening programs, they are not able to just come with the doctor because of the distance they have to cover, or because of the lack of awareness, and because of the fear also. So telemedicine is one such thing that can just uh, discuss with the patient and physician one on one, and that can also help to increase the awareness among those population. So it is very important, and incorporating both artificial intelligence and telemedicine together will definitely help screening program achieve a better outcome, especially in the population like Indian subcontinent.
Right. Thanks, Dr. Anand. So now, moving on to our next question, which is addressed to Mr. Sarkar. Can you provide more insights into how the utilizations of biosimilars contributes to enhancing accessibility to cancer treatments?
Yeah, Dr. Tarinee, I think I touched upon partially in the earlier question with respect to the biosimilars. Uh,
Mhm.
Primarily, with the development of a lot of Indian companies, when you are speaking of biosimilars, I believe you are referring to biologicals. We have various treatment options these days when we speak of biologicals, and cost of treatment and quality of drugs. These are the two most important perspective we have to keep in mind with respect to the accessibility part when you were saying. So, a short while ago, Dr. Qureshi in his presentation also touched upon one point is the state of the art testing facilities and things like MGS panel for personalized care. So, how biologicals has helped in accessibility is with increased number of biologicals today from a lot of Indian companies at a very cost efficient rate. The corresponding testing facility also has seen a market, and as a result, the more and more number of such quality testing facilities come, the patient is getting the benefit of cost not only for the quality medication but also in terms of the testing facility. The sum total of the gain is more and more patients are able to afford, and in terms of increasing the footprint across various parts of the country, or rather to say that accessibility, we are able to increase. So that is the role biologicals has played, biosimilars have played, and the advantage along with the accessibility is the outcome into the overall survival benefits that we see with biologicals. So it's a win-win combination on all aspects.
Right. Thank you, Mr. Sarkar. So now I'd request all our panelists to share a key advice for our viewers, either an experience or any piece of advice that they'd want to share. So I'd like to to start with Dr. Srivastava.
Yes. Uh, uh, if for our patients, I can say, or family members who have first degree relative with colon cancer or rectal cancer, always go for a screening test at starting from the age of either 40 or 10 year or earlier of first degree family relative, like either your father or your brother have diagnosed as CA colon at age of 60 years, then you have to go at 50 years, or he diagnosed at 50 years, then you have to go at 40 years, and similarly. And also any uh, do not confuse or do not uh, go for non-allopathic type of management for figure for blood in stool or weight loss or pain abdomen or obstruction of the intestine, like symptomatic presentation of the CA colon, which can be. So always go for the oncologist or gastroenterologist for colonoscopy, and follow their advice, because if you diagnose very early, you can be cured from this deadly disease.
Thank you, Dr. Srivastava. Now I'd like to move on to Dr. Qureshi to share a piece of advice or an experience with our viewers.
So early diagnosis is the key, and I think the point that this cancer is an eminently curable cancer if detected at an early stage cannot be overemphasized. It's very important that we drive home this point within the patient community, that there is no taboo in addressing your symptoms. Many of the times, the diagnosis is delayed because of the social stigma and the taboo associated with the testing. Many of the patients feel ashamed to bring up topics like bleeding per rectum or having to undergo a colonoscopy or a sigmoidoscopy or a rectal examination. So these taboos and social stigmas need to be disposed of. The myth that is prevalent within the patient community that a biopsy can lead to a spread of cancer, I really don't know where that emanates from. That needs to be nipped in the bud, and we need to tell patients that a biopsy not only gives us the confirmation of a cancer, but it also provides us with vital tissue that will help us to do detailed study on that tissue for molecular markers that can make the treatment more personalized. There are studies going on in the world wherein, in the early stage of colon cancer, chemotherapy sparing approaches have been tried with immunotherapy if the patient harbors a genetic mutation called a microsatellite instability. And these are approaches which are actually revolutionizing the care of colon cancer and taking it away from chemotherapy, and also making the role of immunotherapy more and more robust and more relevant in today's day and time. We may end up with even having a situation where, even in advanced stages of cancer, with these personalized approaches, we may be able to afford some patients cure, and a lot of patients a relatively great disease-free interval, a prolonged disease-free interval, devoid of the side effects of chemo, as well as devoid of the side effects or the effects of the disease itself. And therefore, these two or three points need to be really kept in mind. And if I could just narrate one snippet from my memory, there is one patient of colon cancer who had undergone multiple cycles of chemotherapy, almost 5 6 years in the pipeline. Ultimately, the genetic testing was not available at that point in time, and it had just become available. This patient underwent genetic testing. This patient was of carcinoma stomach, and he was eventually diagnosed as having microsatellite instability high. This patient could not afford immunotherapy for a very long time. He took 5 doses of immunotherapy. It was 2018. Today it's 2024. In a metastatic stage 4 carcinoma stomach, he happens to be disease free for the past 6 years. That is something of a magic, and whenever he comes to us for a follow up, we actually marvel at the options and the potentials that immunotherapy opens up for such patients. And I think that is what needs to be driven home amongst the patient community.
Wow. Thanks, Dr. Qureshi, for such an inspirational story. I'm sure it must be really helpful for our viewers. Now, I'd like to request Dr. Mandal to share an instance or his views or anything that he'd want to share with our viewers.
Yes, everyone said regarding the treatment and diagnostics, everything. But what I will say is regarding the prevention part to some extent. So see, colon cancer is the most curable, or the is one of the cancers in the GI tract which has the best outcomes till now. What we see, barring from the hepatobiliary tract cancers, the stomach cancers. So colonic and rectal malignancies has the best prognosis amongst all the GI malignancies. That's the first thing. Next is regarding prevention. We have the modifiable risk factors like the overweight that needs to be controlled, the alcohol intake that needs to be controlled, avoiding of the red meat which needs to be controlled, and of course more important is the intake of cereals and fiber, higher amount of fiber intake. So these needs to be incorporated in the diet. So lifestyle modification in today's era is one of the most important feature which needs to be done, so that the such malignancies, like one of them being the colonic malignancies, can be prevented because of the lifestyle changes which we have in the present day era. The less amount of the overuse of alcohol, the less amount of fibers in the diet, the incidence of colonic malignancies is on the rise, because we have the unmodifiable risk factors, which is the family history or the genetic predominance of these, which we cannot modify. But at least what we can modify is the modifiable risk factors, and I think we need to stress upon these modifiable risk factors so that the incidence of the disease can be prevented or can be decreased to some extent at least. So this is the message which I want to share. Yes, that so try to take a healthy diet, a healthy lifestyle, so that these many other malignancies also, along with this malignancy, can be prevented to a great extent.
Thank you, Dr. Mandal. Thank you for that advice. Now, moving on to Dr. Anand, I would request you to share a piece of advice that you'd like to share with our viewers.
So it is very important to be aware of cancer symptoms of colorectal cancer, as colorectal cancer is one such cancer where the signs and symptoms occur very early in the disease course, and it is one of those cancer for which screening test is available. Only few cancers are there where we have got a standard protocol for the screening methods, and here we have got a few important screening methods that should be incorporated in the population. Also, it is very important to modify the lifestyle. We should be following the healthy lifestyle, as everybody is saying, and those incorporate the avoidance of the red meat, processed meat, avoidance of the alcohol and smoking. Apart from that, it is very important to improve on the dietary habit, like increasing in the dietary fiber, increasing in the fruits and vegetables, green leafy vegetables. These are the important points which should be incorporated in the lifestyle. Also, I would like to say that even if the cancer has been diagnosed, if it has been diagnosed in the early stage, it can be completely cured just by surgery, or maybe surgery followed by some kind of adjuvant chemotherapy. And these days, what chemotherapy and the dosing which we are giving is almost non-toxic. We rarely see any kind of toxicity or side effect among the patients when we start with some kind of chemotherapy. And in the advanced setting also, there are many instances when people are saying that cancer has been diagnosed in the stage 4 or the advanced stage and it is the end of life, but it's not the truth. There are many patients who are living beyond 3 years, 4 years, who have been diagnosed with stage 4 cancer, and this is just because of the advancement in the treatment modality, especially in the incorporation of the targeted therapy and the immunotherapy, which everybody is looking forward to. And the molecular testing is one such testing. And many times we divide colon cancer or colorectal cancer into right and left side of colon cancer, and they both behave differently. And depending on that, the molecular testing is also slightly different, and the medicines or the targeted therapies which we give are slightly different. And incorporating these targeted and immunotherapy are doing wonders for advanced stage colorectal cancer. And everybody should be aware of what are the signs and symptoms of cancer, and they should be knowing that if we act promptly, and we are aware of cancer and what are the treatment modalities, so we can defeat any cancer, including the colorectal cancer.
Thank you, Dr. Anand. Thank you for your piece of advice. Now, I'd like Mr. Sarkar to share a piece of advice with us, with our viewers.
Yeah. So I think our esteemed doctors in the panel have elaborated a lot already on the various aspects related to personal experience and their advice on how to move ahead in terms of preventive measures. Being into the sales and marketing responsibility right now, what I am going to say is just a small observation which I have seen is and I would like to correlate with Dr. Tanmoy Mandal's version when he said that modifiable risk factors. I like that term very much. What I saw in my experience in oncology is in many of the smaller towns, especially where the healthcare is not that greatly developed. I am talking of maybe now what used to be a small town a decade back. Now it must have evolved over a big city, but still there will be a lot of smaller towns across the country. For any recurrent or persistent problem with respect to any abdominal discomfort, if we could think upon how to propagate the message. Why I am saying this is I find, or rather, I found from my personal experience, a very close, near, and dear ones who was subjected to repeated some quinolone based treatment for abdominal discomfort, and maybe the drug is also banned these days. But the physician over there at that point of time, maybe that was the best alternate possible. Maybe the patient was or his family was not very well versed or well aware. Subsequently, with over a period of maybe 10-15 years, the patient who was having a lot of abdominal discomfort and repeatedly subjected to the same drugs finally ended up getting CA cancer of cecum. In all probability, the doctors felt that it could have been detected maybe quite some time back, and the final detection happened only when the patient had already metastatized to the extent of a liver. So, from my personal experience as a non academic guy, considering I'm into the sales and marketing, I'm a pharmacy graduate. What I feel is if there were ways and means of designing communication to our specialty doctors beyond oncology, how to prime any patient who is coming repeatedly over a period of time for the same discomfort, and to think of something beyond it. What happens is many a times the patient party thinks that doctor साहब ने दवाई दे दिया, he has given medication, I am getting that comfort for 2-3 months. Again he is facing some discomfort. This is how it happens in the initial phase, and over a period of time it becomes chronic in nature, and then something else comes up. This happens with many colorectal kind of a situation. But at the very first instance, if the treating physician directs the patient to have a second opinion, I think a lot of such cases can be taken care at the very onset of the disease, and outcome could be much better. The patient might lead a much healthier life and a longer life. So, to sum up, what I wish is how to escalate those preventive measures to physicians beyond oncologists in smaller towns and cities, how they should suspect and not the patient, not to confine the patient to the same kind of a treatment if the patient is unaware of what might be coming on a later phase. So awareness at the level of physicians holds a lot of importance in terms of quality outcome.
Thank you, Mr. Sarkar, for sharing your own personal experience. Um, so now with this, we would like to conclude our session for the day. I would like to thank our esteemed panelists for their time, for their effort, for their insights, for their experience. Um, Thank you for joining us. And I'd also like to thank our viewers. So stay tuned for our next session of the series and have a good day, everyone.
Thank you very much. Good night.
Thank you. Thank you,
Thank you,
doctors. Thank you,
Team
doctors.
Reddy and Blue Way of Change. Thank you.